Hi. So the career that I chose to talk about was that of a substance abuse and behavioral disorder counselor. And what these people do are work with patients who suffer from things like drug addictions, alcoholism, eating disorders, and other behavioral type problems. They do things like help patients find housing and medical help, employment and peer support, and they also focus on helping with long-term management of the issues that the patients are dealing with. Um, and these types of things also include evaluating the health of the patient and seeing if they're even ready for treatment. They also help the families with discussing how to help this person, and they review treatment plans with the patients and their families and teach the families about addictions and disorders and how to cope with them. And they also help clients with the treatment plans and goals, and a lot of times they also run outreach programs to help people identify and avoid destructive behaviors and addictions. I don't know anybody personally with this career. It seems, though, that there are a lot of different places in Boise when I was looking up different organizations. Um, so the work environment is kind of stressful for these people. Most counselors work full-time in places like prisons, probation offices, mental health centers, residential treatment facilities, hospitals, private practices, juvenile detention centers, or community health centers. The job's pretty flexible on average, but there's not a lot of room for people to move up in the field. A typical day will depend on where you work. Usually publicly funded centers have really high caseloads and regulatory requirements, and because of this they're usually open later into the evenings and on weekends, so these people work kind of a lot. In outpatient facilities, counselors meet with patients for 45 minutes once or twice a week. And the stress level, like I said, is above average, and the emotional strain and lower pay can make it seem like a hard job, but a lot of counselors, from what I was looking at, say that the fact that they can watch these people turn their lives around is really something that compensates for the hard things that they have to deal with. Some of those hard things are the large workloads, a lot of people that they're seeing, especially if the place is publicly funded. And sometimes they don't have the resources for the demands of their services. Another stressful thing that they have to deal with are agitated patients. Sometimes the patients that they have don't even want to be there, and they're only there because they're court ordered to be there. So that's something that's really stressful, is dealing with these people that don't even want their help. And oftentimes a lot of the counselors will have to intervene in crisis situations, which are really tense and require a lot of emotional control and stability from them. Depending on the type of place that you work at, there are benefits. Sorry. There's things like varied health benefits, medical, dental, vision, and there's also things like flexible spending accounts, tuition reimbursement, savings bond programs, long-term disability, and employee assistant programs, which a lot of these people actually help with sometimes if other places offer the employee assistance programs. They're basically services offered through this type of counselor to help with personal problems. So for the education, it depends on where you work and your level of responsibility, and also state regulations, but the education varies from a high school diploma all the way to a master's degree, so there's different areas you can work in depending on what kind of education you have. People with more education will have less supervision, and licensed counselors can do one-on-one counseling, and the way that you get licensing will depend on the state. People who have only high school diplomas have to take a test, and they also have to have on-the-job training with the type of clients that they're going to be dealing with. The salary range, the median salary is about $38,000, somewhere in between 38 and 39, which comes out to about $18.52 an hour. And in 2012, the average salary was $40,000, almost $41,000. Highest paid counselors are $60,000, and the lowest paid are earning less than $25,000. Some of the highest paying places are Michigan, Wisconsin, and New Jersey, and the higher paying jobs will usually be in places like hospitals, where the lower paying jobs are usually the residential facilities. Just some miscellaneous information. It's projected that the employment for substance abuse and behavioral disorder counselors will grow 31% by 2022, which is a lot faster than most occupations. And the reason for this is because a lot of insurance policies are covering addiction and mental health counseling services. And another fact is that a lot of courts are sending offenders to rehabilitation instead of jail. They find that it's less likely for them to commit another crime if they've gone to rehabilitation rather than just to jail. And it's expected that the jobs in residential treatment facilities will increase at a higher rate than, say, like the hospital type jobs. As far as the education requirements go, there's a lot of things. There's a lot of people who have overcome addictions themselves, and they're oftentimes the best counselors because of their experience. And so sometimes their experiences will sort of outweigh the education that they have because it sort of gives them a leg up. They kind of know how to put themselves in the shoes of the patients, and so that really helps, but they still have to have the on-the-job training and pass the tests and things like that. So yeah, this job is pretty interesting. It sounds like something sort of stressful, but you would be helping a lot of people. So I would look it up if you're interested. There's a lot of information on it. Thanks.